A warm welcome to everybody. We have with us Dr. Sireesha, and Dr. Sireesha has cleared her FMGE exam with a very good score. Dr. Sireesha, I want you to introduce yourself, which university you are from, and what was your score?
Hello, sir. Hello, everyone. I am Sireesha, and I am from Smolensk State Medical University. And I had scored 219 marks in this FMGE Jan 26.
This
And
is
I
your,
am,
this was your first attempt, Dr. Sireesha?
yes, this was my first attempt.
Nice. From Smolensk. Nice.
Yeah, from Smolensk.
And which branch of ARISE you were in, or you were the online student, or which branch?
Yes, sir. Actually, I was an online student.
Nice.
And I took Infinity batch
Acha.
from February.
Nice, nice. How useful was starting with Infinity Batch for you, Dr. Sireesha?
Yeah, sir, I was a bit confused in the starting of the preparation, and one of my friends suggested RIs. So we, as a whole, our whole friends, we took RIs, and we used to attend all the Infinity courses from February until June. And throughout the preparation, we were very consistent.
Nice.
Yeah, 3 hours we had to attend the class. So evening 4:30 to 7:30, we used to be in the room only.
Nice.
So it was the consistent throughout the 4 months before my preparation starts.
Nice. And how did the Infinity preparation help you during the main preparation back in India?
Yeah, sir. Actually, to be honest, I had little knowledge about PSM and some subjects like ANIT and all. So that these subjects I had over there. So that helped me brush up my knowledge, and that helped me a lot during my preparation here also.
Nice, nice. And Dr. Sireesha, when you started this journey, what were the major questions that you had in your mind? Were you confident that this will happen, that you would end up scoring 219 in the first attempt, or what was in your mind?
Sir, to be honest, I barely thought I would pass the exam because the hype everybody gave, it was like tougher. You can't crack it on the first attempt. You have to give more efforts. You have to be consistent and all. So that made me scared. So
You just
I
wanted
thought,
to
okay,
pass. That is enough.
yes, sir.
Nice. And Dr. Sireesha, how was your journey with ARISE? Like the whole model, the scheduling, the faculty, the workbooks. How did you find the whole journey?
Yeah, sir. Actually, after coming India, first I had July, my first class on July 1st. From that itself, and I had your
Video
talk.
Yes,
Yes,
I had communicated with you.
yeah, sir. So that time you told like you have to be consistent. And the only thing you have to be make the subject easier is familiar with that. So that line stuck to my head. So I thought I should make the subject familiar to me. It's like multiple time revisions. That's the only key that made me here. That's the only point, sir.
Nice, nice. So you had focused on seeing that all your workbooks, all your subjects are familiar even till the day of exam, right? So you didn't let them go into your.
Yes, sir.
How did you keep it familiar, Dr. Sireesha? How regularly you would revise them?
I followed Priyan's that method of revision. Yeah, from the day I had biochemistry with him like September. So at that time he gave the chart of revising. So I just completely followed that. 7 days gap. I thought I have to take the subject again and again, just flipping the pages without any while flipping we don't get any satisfaction. I thought, okay, I will be doing this till the last day of the exam, and I just flipped it, and somehow
it worked well.
It worked. Nice. Yes, sir. I wanted to thank to Priyan sir also because
That's really worked. Many students are saying that. Nice. And Dr. Sireesha, You must have met so many different faculties. Each subject faculty has his own charm and own way of, easing out subjects for the students. Any special mentions that you would want to give for the subjects and the knowledge that you have gained from those subjects?
Yeah, sir. First, that radiology, that book is not only radiology; it's completely all the subjects integrated, sir. First, I felt overwhelmed, but as you said, if you are familiar to that, it will be very easy at last. So first, I was scared. Looking books, contents, but once I keep taking the book, keep flipping and keep revising, it felt very easy to me to approach the questions and all, because a lot of ENT questions, a lot of surgery integrated radiology questions, everything was from the book itself.
Nice.
And yeah, so from the starting to the ending, if we are thorough with all the 19 subjects book, which 𝗲𝗍, we can crack, means we can get more than we think, score itself.
Nice, nice. And Dr. Sireesha, how important was MCQ practice for you? How did you integrate this with the class schedule, live class schedules?
I used to do 50 to 100 questions, sir, but it was not consistent. Sometimes I did not do, sometimes I did, like that. It was like that. But somehow I tried to maintain it in a regular basis. Yeah.
So you were mostly in your content. You wanted your content to be clear. You want the workbook to be very strong, and
yes,
MCQs patchily in the beginning.
Yes, and my thought was, at last, till the last day of the exam, I should keep revising the subject. So that was my only motive, sir. Other than that, even that MCQ also, I was taking side by side.
Nice. Which place are you from, Dr. Sireesha, here in India?
Yeah, sir. I'm from 𝗙𝗵𝗵𝗺 in Tamil Nadu.
Nice, nice. And how did you maintain that discipline at home? And these classes are so long, right? And regular classes and so many things to do within a short duration of 3 months. We have to complete those 19 subjects, the 19 workbooks. How organized were you? And any tips that you would suggest the students?
Yes, sir. Actually, consistency is the only thing we have to maintain, and the discipline. Without that consistency and discipline, success, I don't think we can get that. Even long hours studies, and because all the days will not be same. Sometimes we feel low, sometimes we feel high, but that consistency we have to maintain.
Agree.
We'll succeed there.
Nice. So irrespective of the motivation levels, you have to stay consistent. That is what we mean to say. Right?
Yes, sir.
And Dr. Sireesha, anything during this phase, initially some students are very, very positive and very active, but they start dipping down in the middle of the phase, seeing that the subjects piling up. How did you handle that phases?
At start, I also had that okay, we are doing this. So I had a little paced up in the starting phase. But after coming like last 2-3 months, I went very low, and I felt, and then I understood that all the days will not be the same. Some days will be low, some days will be high. If I have this low phase, I'll tell myself, okay, the next upcoming days will be good. So if you are low, then let it be low. Just relax.
The low phase is over.
Yeah. After that, the good phase will come, and we have to we have to catch the pace up again.
Nice. So plan it out in a way that when you have full on energy, you ride the show properly, and there would be some low phases. Don't be worried that it's not going to be permanent again. And you will have a better phase coming again, and you will need to bounce back through that phase. Nice.
Yes, sir.
And Dr. Sireesha, after having done the subjects, you go into the test and discussion, the revision phase. How was that handled from your side?
Yeah, sir, I used to attend all the test and discussions.
Was the time sufficient to complete and attend the test? Would you complete that subject in that given time, or do you think there was you planned it in your way?
No, sir, that 𝗲𝗍 timetable was the complete setup. Like, we can't tell it's not enough for the student. So it was good. I could do my revisions, and I could do my MCQ itself at the same time also. So the time was enough, and I could prepare really well at that time also.
Nice.
So after the test, and I used to attend that discussions from the faculties, and I would suggest students who are preparing for FMG that stick to one source is more important, and trust the faculty is more important, because at my time I also thought this faculty is not giving enough information. What would I do if there will be more content in the exam? So I used to think, okay, I should get some more info from other apps also. But after the 2-3 months after, like nearing to the exam, I thought this itself is more than enough.
True.
Keeping this stuff in the mind is more than enough.
Agree.
Yeah, because these things will never stay in mind without revising, and like little content is more than enough, because we can't store everything in the mind at that point. So little content means that if we revise that will be definitely coming in the exam, and we'll definitely do that. So less the content, more revision. That's what I thought in the last time.
I think you can stick to the workbooks. The workbooks are very, very carefully designed, and we take a lot of responsibility for when we create that workbooks that, our students who are trusting that should do well. And as Dr. Sireesha is mentioning, get familiar, repeated revisions with this content should get you good results also. And I can see a lot of sticky notes, Dr. Sireesha, on your study table. Can I just have a look of that place also?
Yes,
This is
sure.
your place of study, right?
Sir.
Oh, amazing. Now I can understand.
Thank you, sir.
Beautiful. And how did you manage the stress, Dr. Sireesha?
I have my parents here, so
Yes.
whenever I get some low time, I used to talk to my mom,
Okay.
and she was the only stress reliever. I just go out, and because I'm little distracted. So if something happens to me, like YouTube or Insta, anything, my mind suddenly gets off from the track. So I thought I was very careful that if I want some relaxation, I can go and talk, and I can go out for some walk.
True.
Yeah.
I think that's an important advice that you mentioned, staying away from social media. And there is so much on the social media which can distract your mind from, and distract your focus. So I strongly suggest, especially people who are in this intense phase of preparation, to cut down on the social media presence for some time. And Dr. Sireesha, please let me know about the exam day. You have written so many exams during your TNDs, GTs you must have tried. What was the experience on the exam day?
Sir, you would not believe that exam day was the most difficult. The exam was the most difficult GT I have ever given in the last 6 months. I would not say exam was so easy. It was one of the difficult, yes, sir, one of the difficult test papers I had given, because those were the unexpected questions I have never expected it to be on the exam day. And after the part 1 of the exam, I thought, what was going on? Did I really do well? I thought I would definitely, I would, I didn't, to be simply, I did not know what I was doing.
Answering, yeah.
Yes,
You're
sir.
not too sure about your answers, and that anxiety starts coming in. Am I doing the right thing? Am I choosing the right options, right?
Yeah, sir. Actually, this time I thought like path, micro, and PSM. There are different questions I had never directly seen in the GDs and all. But those questions were little tricky. If we are strong with the basics, and if we are good with our test and all, we can do that. On that moment, I thought, okay, exams had leveled up. So that was the only thing that came to me. So our preparation, I suggest juniors, like, preparation should be little more. I felt.
It should be on the higher side and should not take it very superficial and easy ways.
Yeah, sir. Yeah, sir. Because that questions were little longer, and we have to read carefully, and the time was lesser. I felt that.
Agree.
The second paper was, yes, sir.
Many students were telling that lengthy questions had come this time, and the time was a major factor for them.
Yes, sir.
Any specific subjects you felt were heavily tested on the exam?
I felt PSM was not so easy, and even micro and patho, some slides were not directly familiar. And in second paper, OBG surgery, everything was little okay for me, but I got little scared by seeing the first papers.
Okay. But I think, coming with 219 marks, there's a lot of learning that has already happened, and you're a person who would want it to be very accurate, right? Then only
Yeah,
the
sir.
satisfaction
Yeah,
is
sir.
there.
I actually felt after coming, like after finishing the exam, I told my mother that I don't know, I would barely pass the exam because that much. I couldn't predict anything, sir.
Nice.
Because all these GDs, I could predict. Okay, I can get this much marks, that much marks. But after after the exam, I was blind literally.
Nice.
But somehow after seeing the result, I thought. All these marks only because of my preparation phase. Like 6 months effort we have given, so we got this much mark.
Yes.
That I felt on that day.
Had you gone through the recall, Dr. Sireesha? We released the recall. Have you gone through that, or you were not very, wanting to get that stress now?
Sir, actually, I was a little scared, so that I was not doing any recalls. But after the result come, I saw all the recalls. So at that time, I felt okay.
After results, you saw the recall. Nice.
But at that time, I realized I did not do very badly. It was okay, I did, but that scare didn't want me to see the questions.
Okay. Really. And Dr. Sireesha, like any doctors in your family, and how did this decision of MBBS abroad, going to Smolensk, and the whole journey start for you?
I am the first doctor in my family, sir, and I was not planning to do MBBS. First, I was thinking to do engineering, so I applied for that, and suddenly my senior's father came to my home and they had a talk. And my mother, okay, you can try for this, because at the time I passed a NEET UG, but my preparation was not serious. I just gave NEET UG simply. And then it happened, and my FMG preparation started from Infinity batch itself. And before that, I was doing for college exams. Like 5th year, 6th year, I was doing for the college exams, and I did particular subjects in a good manner.
Nice.
So it was like that.
And coming down and clearing with such good results, right? And that shows a lot of hard work, and intense phase of hard work. Once you started with the last phase, I think you picked up at the right time. It's important to peak your preparation at the right time. Yeah.
Yeah, sir.
And Dr. Sireesha, like, what was the major factor that kept you driving throughout the hard work? What was the thing that, like, I have to do it in this attempt? What was the main factor for that?
Sir, I always wanted to be good in what I'm doing. So I thought I can pass this exam and I have to get good scores. That was my only motive. And so I thought if I'm low in any phase of my preparation, God will not do justice for me. So I was little scared to that factor also. And like, my satisfaction should be there. If I'm giving my 100%, at last I'll get that satisfaction. So that was my only factor.
Nice. So be honest with yourself, with your efforts that you're doing, and only after putting your efforts you can expect the results. Agreed.
Yeah, sir. And manifestation also matters. Like, yeah.
Agreed. Amazing. It was such lovely talking to you, Dr. Sireesha, and I really appreciate the kind of efforts that you have done, especially from the Infinity batch with us, and sticking out to the process, trusting the process till the last day. And we are, really happy. I can see the effort that you have kept in through your study table, and you're very organized and come out so successful. And we are all proud of you, Dr. Sireesha.
Thank you,
about
sir.
the batch, Dr. Sireesha, how did you find your online live batch? I mean,
Yeah, sir, it was
interaction, so much fun going on.
Yeah, sir, it was very interesting and little bored. Whenever we feel bored, the faculties themselves, they get us engaged, and it was a smooth journey, sir. Actually, I didn't feel any tired in between. Sometimes, all the online classes, I felt I attended all the online classes on time, sir. I didn't do recordings. So
the batch was also very, very energetic. And we have got such good results also from the students there, and we are really proud. And the kind of results that these group created, right? We've seen so many pass out results and such good scores. It made us so happy and so proud also. And very happily, very, with so much of fun, they came, they did the work and completed it. And
yes, sir.
and how did you find the interactions with Dr. Nadeem, right? I think you mentioned Dhawan sir, Priyan sir. How any other mentions that you would want to say?
Sir, all the faculties were clear in the one thing that you will definitely pass the exam. But just make sure you do revision on the time and you keep revising till the last day of the exam. And I took that seriously, and the only key of my like marks and all is the revision, sir. That should be there in all of our juniors who are preparing for the exam, because sometimes we leave the subject. If we leave the subject, I felt the subject will leave me. So that I just kept, I was carrying the subject with me throughout the exam, sir. And all the faculties like Nadeem sir, Dhawan sir, Priyan sir, they were encouraging us in by each time. Nadeem sir and Dhawan sir, they were very active in the live sessions, so that we also felt very engaging in that.
In the class. Nice.
Yes, sir.
And heartiest congratulations, Dr. Sireesha. Like really proud of your efforts. Amazing score. You made your parents proud. You made all of us at 𝗲𝗏 proud. All the faculty members, they feel so happy to see your results in the first attempt, and you will be a source of inspiration to a lot of your juniors in your college. Okay, and coming down.
Thank you, sir. Thank you, sir.
At the right time. Okay.
Thank you, sir. Actually, I also wanted to mention that your efforts, sir, because I still remember at the starting phase, I messaged you for some reason, sir. I don't get the workbooks and all. So I texted you on the Telegram. Among that hurry and in your busy schedule also, you made sure that all of the students are comfortable, and all of their needs should be like taken care of. So at that time also, I felt very
and I'm happy, Dr. Sireesha, the kind of...
Sir, your screen, I guess.
Is it visible?
Yeah, sir, but it's stuck, I guess.
Yeah. Please continue, Sireesha. Dr. Sireesha, we can hear.
Yeah, sir. That means your thought of making us comfortable. That was the main, most important thing. The major part, make us comfortable in this journey, sir.
I'm really thankful, and the kind of trust and the kind of responsibility that comes in makes each of us at 𝗲𝗏 very responsible. And it was nice talking to you, Dr. Sireesha. We wish you a lot of good luck and wish you have a bright future ahead with us.